Home care for patients with diabetes. Diabetes occurs when the pancreas produces too little insulin or does not properly use insulin. Without insulin to process glucose, these sugars collect in the blood and cannot get to cells. This causes problems with circulation and can damage vital organs. Define the following terms. Insulin, a hormone that works to move glucose from the blood and into the cells for energy for the body. Glucose, a natural sugar. Prediabetes, a condition that occurs when a person's blood glucose levels are above normal but are not high enough for a diagnosis of diabetes. Gestational diabetes, a condition in which pregnant women, who have never had diabetes before, develop high blood glucose levels during pregnancy. Home health aides should know these facts about diabetes. The body does not produce enough, or the body fails to properly use insulin, which is type 2 diabetes. The glucose collects in the blood, causing circulatory problems. Diabetes is common in people with a family history of the illness, in the elderly and in people who are obese. Two major types of diabetes are type 1 and type 2. Type 1 diabetes is usually diagnosed in children and young adults, when the pancreas does not produce any insulin. It is a lifetime condition. Type 2 diabetes is the most common form that develops slowly, typically after age 35. Other types include prediabetes and gestational diabetes. Patients with diabetes may have the following signs and symptoms. Excessive thirst, extreme hunger, frequent urination, unexplained weight loss, elevated blood sugar levels, glucose in the urine, sudden vision changes, tingling or numbness in hands or feet, feeling very tired much of the time, very dry skin, sores that are slow to heal, more infections than usual. No. Home health aides should understand these complications of diabetes. Changes in the circulatory system can cause heart attack, stroke, poor extremity circulation, poor wound healing, kidney and nerve damage. Damage to the eyes can cause vision loss and blindness. Poor circulation and impaired wound healing can lead to leg and foot ulcers, infected wounds and gangrene. Insulin reaction, as well as diabetic ketoacidosis, are serious complications of diabetes that can be life-threatening. Insulin reaction, or hypoglycemia, is a complication of diabetes. Hypoglycemia occurs when blood sugar drops below 70 mg daily. May result from too much insulin, too little food, for example, skipping a meal, too much physical activity, strenuous exercise, or vomiting and diarrhea. The first signs of hypoglycemia include weakness, nervousness, dizziness, perspiration, sweating. Other signs and symptoms of hypoglycemia include the following: hunger, headache, rapid pulse, low blood pressure, cold and clammy skin, confusion, trembling, shaking, numbness of the lips and tongue, unconsciousness, blurred vision. These signal that the patient needs food in a form that can be rapidly absorbed, such as carbohydrates, a glass of milk, or fruit, orange juice, or water with sugar dissolved in it. Notify your supervisor and the agency if the patient has shown signs of hypoglycemia. If the patient's blood sugar does not return to a normal level after taking in the carbohydrates, call 911 immediately. Diabetic ketoacidosis is another complication of diabetes. Causes: too little insulin, undiagnosed diabetes, going without insulin or not taking enough insulin, eating too much, not getting enough exercise, infection, physical or emotional stress. The signs of the onset of diabetic ketoacidosis include increased hunger, thirst or urination, abdominal pain, deep or labored breathing, and breath that smells sweet or fruity. Notify your supervisor and the agency immediately if the patient shows the signs of diabetic ketoacidosis. The agency's policies and procedures regarding contacting emergency services must be followed. Other signs and symptoms include the following: headache, weakness, rapid, weak pulse, low blood pressure, dry skin, flushed cheeks, drowsiness, nausea and vomiting, shortness of breath or air. Parameters that home health aides need to know. Normal blood pressure level is 90, 60, 120, 80. Normal blood sugar level is 70, 100 mg DAL. Non-diabetic. Normal pulse is 60, 100 beats minute. Care guidelines for patients with diabetes. Follow diet instructions exactly. The intake of carbohydrates, including breads, potatoes, grains, pasta and sugars, must be regulated. Meals must be eaten at the same time each day. The patient must eat everything that is served. If the patient refuses to eat what is directed, or if you suspect that he or she is not following the diet when you leave, report this to your supervisor and the agency. Care guidelines for patients with diabetes. Encourage the patient to follow the exercise program. Regular exercise is important. Exercise affects how quickly bodies use food, and it also helps improve circulation, as well as maintain a healthy weight. Exercise may include walking or other activity. It may also include passive range of motion exercises. Assist the patient with exercise if necessary. Be positive. Try to make it fun. A walk can be a chore, or it can be the highlight of the day. Care guidelines for patients with diabetes. Observe the patient's management of insulin. Doses are calculated exactly. Doses should be administered at the same time each day. Home health aides are not permitted to inject insulin. However, the home health aide may be asked to bring the insulin and supplies to the patient, to check the expiration date, to store the insulin, usually in the refrigerator, and/or to keep a record of where on the body the insulin was injected. Know when patients take insulin and when their meals should be served. There must be a balance between the insulin level and food intake. Care guidelines for patients with diabetes. Blood glucose monitoring is very important for patients with diabetes. A fingerstick blood glucose test is one type of blood test that may be used to check blood sugar. This is a simple test that is performed by quickly piercing the fingertip, then placing the blood on a disposable strip. The strip will indicate the result. Another type of test involves using strips along with a blood glucose meter, a special glucose monitoring machine that can only be used by one person, not shared. Home health aides are not permitted to perform blood glucose tests on patients. However, the home health aide may be asked to bring and prepare the necessary supplies for the patient, help the patient review the blood sugar result if it is at a normal level, and/or keep a log of the blood sugar results if directed in the plan of care. Care guidelines for patients with diabetes. Proper foot care is vitally important for patients with diabetes. Provide foot care as directed in the patient's plan of care. Because diabetes causes poor circulation, even a small sore on the leg or foot can grow into a large wound that may not heal. This can result in amputation. Careful foot care, including regular inspection, is very important. The goals of diabetic foot care are to check for signs of irritation or sores, to promote blood circulation, and to prevent infection. Care guidelines for patients with diabetes. Encourage patients with diabetes to wear comfortable, supportive, well-fitting shoes that do not hurt their feet. Shoes made of material that breathes, such as leather or cotton, Help prevent buildup of moisture. To avoid injuries to the feet, patients should not go barefoot. Socks made of natural fibers, such as cotton or wool, are best, because they absorb sweat. Socks should not be too tight. Home health aides should never trim or clip a patient's toenails. Only a nurse or a doctor can do this. Care guidelines for patients with diabetes. Report any of the following to the agency. Any sign of skin breakdown, especially on the feet and toes. Change in appetite, patient overeating or not eating enough. Weight changes. Changes in mental status. Increase or decrease in urine output. Visual changes, especially blurred vision. Change in mobility. Change in sensation. Remember, home health aides do not cut patients' toenails. Observation of the feet is important to the health of a patient with diabetes. Meal planning in diabetes. Patients with diabetes must be very careful about what they eat. They must eat the right amount of the right type of food at the right time, and they must eat everything that is served. Calories and carbohydrates are carefully controlled, and protein and fats are also regulated. Foods that are high in sugar should be avoided, as they can cause problems with insulin balance. The foods and the amounts are determined by nutritional and energy needs of the patient. A registered dietitian (RDT) and the patient will make up a meal plan, including snacks. Meal plan is a plan or menu that includes all the right types and amounts of food for each day. The RDT will also determine the proper amount of carbohydrates for the patient in order to keep blood glucose levels within a healthy range. No. Remember, a patient with diabetes will help create his or her own diet along with a dietitian. And home health aides should observe what and when a patient with diabetes eats. Home health aides are not responsible for creating meal plans for patients. It is done by a registered dietitian (RDT). However, if assigned to prepare food for the patient, the home health aide should follow the diet exactly. If the patient is not following the diet, it must be reported to your supervisor and the agency.